Imagine you're in an accident and you're rushed to the hospital and you've lost a lot of blood, and doctors are ready to give you a blood transfusion. But there's a catch. Not all blood can save your life. In fact, getting the wrong kind might kill you. That's because not all blood is the same, even though it may look the same. Have any of you seen those Stop the Bleed boxes scattered around campus? They're typically full of tourniquets and pressure bandages and all things meant to stop bleeding, hence the name. But have you ever wondered what happens after the bleeding is stopped? Well, for small amounts of blood loss, nothing needs to happen. But for large amounts of blood loss, you'll be given additional blood called a transfusion, which is a potentially risky procedure if it's not performed correctly. I'm a pre-nursing student here at UAF and will eventually be transferring to UAA to start their actual nursing program, but I'll still attend classes here at UAF. I think cardiology, which is the study of the heart and cardiovascular system and the disorders that relate to those, and hematology, which is the study of blood and blood disorders, are incredibly interesting subjects, and I could talk about them for hours. Different blood types are incredibly important, and knowing your own personal blood type could be the difference between life and death. Today, I'll be talking about what blood types mean and how they're different, what rhesus factors are, and why they're all so important. So, what is blood? Blood might all look the same, it's all red and wet, but it's made of several different parts. There's red blood cells, or erythrocytes, and they carry oxygen. There's different types of white blood cells that fight infections and fight invaders. There's platelets that help make blood clots and stop bleeding. And then there's the plasma, which is like the glue that holds it all together, but it's actually more or less water. And on the surface of every single red blood cell are little name tags made of proteins called antigens. And these antigens determine your blood type. Type A blood has A antigens, type B blood has B antigens, type AB blood has both A and B antigens, while type O blood has neither A or B antigens at all. And your immune system is very picky. It only tolerates blood with the right name tags. If it sees unfamiliar antigens, it will treat them like an invader and it'll kill them. That's why blood transfusions must be carefully matched and monitored. In the Journal of Technology and Healthcare, Yin Jiang LV states that there are 4 ABO blood types according to the presence or absence of A antigen and B antigen on the erythrocyte membrane. In the A blood group, only the A antigen is contained on the membrane. In the B blood group, only the B antigen is contained on the erythrocyte membrane. Those that contain both A and B antigens are referred to as the AB blood group, while those that have neither A nor B antigens are the O blood group. And besides the A, B, and O groups, there's another marker altogether called the rhesus factor, named after the rhesus monkey in which it was discovered. And either you have the rhesus factor or you don't, which is indicated by saying you are either positive or negative. Me, I am O positive. So, if you're A positive, your red blood cells have both A antigens and rhesus antigens. And if you're O negative, you have no antigens at all. And the rhesus factor is especially important during pregnancy. If a rhesus negative mother is carrying a rhesus positive baby, her immune system might start making antibodies that will attack the baby's red blood cells, which can kill the baby and result in a miscarriage. Fortunately, a drug called Rogam will prevent this reaction from occurring. In the journal Trauma, Surgery, and Acute Care, Dr. Matthew Levy states that when O-positive blood is administered to females of childbearing potential, ensure that it is communicated to the receiving attending physician that rhesus factor positive blood was transfused. And it is important to communicate rhesus positive blood has been transfused because blood type compatibility is a matter of life and death. But what happens if blood types are messed up? Well, if someone with type A blood receives type B blood, or switched around, their antibodies will attack the donor cells. The blood will clump, circulation will stop, and organs can fail. That's why hospitals maintain large supplies of different blood types. O-negative blood can go to almost anyone, and is known as a universal donor, while AB-positive people can receive from anybody, and they're known as the universal recipient. And knowing your blood type helps medical teams act faster in emergencies and ensures that blood transfusions are used safely. In the journal American Family Physician, Dr. J. Raval reports that allergic transfusion reactions range in severity from the most common form of isolated cutaneous involvement, meaning it's just affecting a small area of skin, with angioedema, all the soft tissues are swelling up, and respiratory involvement, all the way to hypotension, shock, and complete cardiovascular collapse, which means death, thereby highlighting the importance of every single blood type, because every patient's life depends on a perfect blood type match. So hopefully now you've learned about blood types, rhesus factors, and the importance of matching each type properly. You understand why blood types are incredibly important, and why knowing your own personal blood type could be the result and difference between life and death. So, while all blood may look the same, the devil is in the microscopic details. Blood types are like nature's barcode, and they are unique and essential for life.